Hopefully it's recording. Yep, it says recording. All right. All right, for rehabilitation of the ankle, foot, and lower leg. We talked about three primary components to it. First is flexibility, working on range of motion after an injury. The second is strength. And lastly, we have proprioception, which is balance. So I'm going to take you kind of through some things that we might do for your typical ankle sprain. Maybe someone has some shin splints, so we talked about shin pain, medial tibial stress syndrome. So first thing is, and this is for your portfolio too. So I hope you guys are kind of taking some notes and taking action. We'll talk about what's due after I get through some of this stuff. So the first thing we're going to do for flexibility would be non-weight bearing, right? Someone has an acute injury and they're non-weight bearing, so they can't really do a normal stretch. So you can use a towel stretch. You can use a stretching strap. I was going to bring one up from the training room, but I didn't. Not everyone has one of those, but everyone has a towel. So this would be to stretch the gastrocnemius and soleus. You'd have your patient long sitting on the table, so you're going to scoot back a little bit. Put your foot off. Perfect. That's good. That's the way you were. And then you're going to put the towel around the ball of the foot, around the metatarsal heads, and give them the towel. And they're going to actively dorsiflex while pulling at the same time into dorsiflexion to stretch the calf. So this is before they can put their own body weight on it comfortably. You're going to stretch the gastrocnemius that way. So again, it's forced dorsiflexion with the knee straight. To get the deeper soleus, you would have to bend the knee. It's a little harder to do here. If you scoot back off the table for me. And then same thing, we'll loop this around down at the bottom. And then with your knee bent though, keep your heel underneath. You're going to do the same thing. Forced dorsiflexion. Okay, nope, keep your knee bent. Just like that. So we're going to do the same thing. You're doing dorsiflexion, but the knee's flexed. That way you're going to hit the soleus, the deeper of the two. So you're going to feel that stretch a little different than when you straighten that leg, right? Straighten the leg and then stretch. Same way, you're going to feel a little different. You should. Oh, yeah. Yeah. So two different muscles share that same Achilles tendon. So we want to make sure that we stretch both of them. So that's non-weight bearing. Okay. When your athlete can walk and put some weight, we're going to stretch basically the same way. Okay. But we're going to do it with our body weight. So gastrocnemius, make sure that my feet are parallel. Kind of like think about being on train tracks. And my shin to my shoe. So I'm putting my weight and trying to keep my heel down. So the angle is decreasing to, again, stretch the gastrocnemius. To stretch the soleus, you got to bend the knee and do the same thing. So what I do is I kind of sit down and I drop my hip down towards my heel, driving my shin forward. So same thing, bent knee, and I'm forcing plantar or dorsiflexion here to stretch the soleus. Okay? So those are weight-bearing stretches. You can also use the slant board. This you can adjust the height. I'd start a little bit lower and have them stand on the slant board. You can stand in the middle and kind of single leg. Bring the hips forward as the leg is straight. Again, think of train tracks. You don't want to be rotated at all. So you guys can see that. I want your hip square. And I like to do single leg. You can stand on both if you want. I'm not getting much of a stretch. So bring that slant board up a little higher. And now it's hard for me to get my hips forward. So now I'm feeling a much better stretch there in my gastroc. I don't think I could stand on here if I go higher. If I do go that high, I probably need something to hold on to. Again, look at where my hips are. My hips probably aren't even over my heels. So really this one is, I definitely can't stand. I don't have that flexibility. Some might, I don't. To do the soleus with the slant board, it would just be this action. Remember, you got to bend the knee to do that. So the knee's bent. Drive that knee kind of over the toe. Shin to the shoe is what I say with the knee bent. So that's using the slant board. It's always an option. Okay, that is plantar flexors. For dorsiflexion, to stretch the tibialis anterior, you can have your patient, and you should always demonstrate so they know what you're talking about. You just have them cross their leg, and then they're just gonna kind of support a little bit behind to put a little break here behind the tib fib, and then just pull themselves down into plantar flexion, okay? Try not to have your toes out to the side. I mean, you can definitely kind of stretch throughout that whole range of motion if you want, but make sure that you're definitely down into plantar flexion. And then, you know, you can pull into inversion and eversion. You'll feel a little bit differently. So that's just a non-weight bearing. We don't really weight bear here, but if I'm going to do it weight bearing, I like to take the shoe off so I can curl my toes underneath, put my toes into flexion, and then open that angle up, right? Forced plantar flexion. And you feel that stretch in the anterior aspect of the shin. So that's flexibility, non-weight bearing and weight bearing with the slant board. And plantar flexion and dorsiflexion. And you can always, you know, definitely stretch inversion, stretch the everters, stretch a little bit. I don't do those stretches during rehab. I just focus on plantar flexion and dorsiflexion. We'll show you the range of motion that we're doing. Okay, into strength. So strengthening exercises might just start with active, passive range of motion or active range of motion. So go ahead and scoot back. Just your foot off the edge, perfect. So just active range of motion, you're strengthening. So go ahead and bring your toes up and then down as far as you can. So dorsiflexion, plantar flexion. Just the resistance is the weight of his foot. So you can see when he pulls up, tibialis anterior fires, gas pedal, gastrocs fire. So there's not much resistance there, okay? Inversion and eversion, you're gonna bring the sole of your foot in and then the bottom of your foot out. Good, in and out. Good, make sure your hip doesn't rotate. A lot of times people will make a mistake and their hip will rotate. So you gotta just kind of either stabilize here to make sure that they're not using their hip, or just give them that verbal cue and watch their knee. All you have to do is look at their patella, and if the patella is going left and right, they're rotating their hip. So if their kneecap stays stable, they're using just their ankle, which is what you want. Okay, so a progression from that could be manual resistance, I think, because manual resistance means you use your hands. So if I want to provide manual resistance, I can make it really easy, or I can make it really hard. So your other is using bands, right? I call them TheraBands, but they're just resistance bands. TheraBand is a brand, so really they're just resistance bands. They have tubes or flat bands. Buy whatever you want. Personal preference after trying them, what you like. So I would say manual resistance before bands. So remember, we need to strengthen concentrically and eccentrically. So what does the tibialis anterior do? It does dorsiflexion, but we have to not only provide resistance for dorsiflexion, we also have to have them resist when we go back down into plantar flexion, okay? So go ahead and start with your toes down, okay? And go ahead and pull your foot up, all the way up, toes to your nose, all the way up, and slowly let me take you back down, okay? Up, and slowly down. And they get kind of choppy on that down, that's the eccentric. That's where you really need to focus on, is all the way up and then slow back down. So I can do it really light. I'm not giving him much resistance here. As far as you can, much range of motion. And I'm gonna give him as much as I can. Make it really, really, really hard for him, okay? So that's where I would place my hands for resisted dorsiflexion, plantar flexion. Go ahead and bring your foot up and then go ahead and push down like a gas pedal. Slowly let me push you back up. Good, again. And up again, slow, up, down. Good, so that's, I'm just kind of giving some resistance with my thumbs. I could use my whole hand if I wanted to. Don't let go on the way up. Resist it up. Don't let go on the way up. Resist it up too. There you go. Good. So you got to make sure that they're not forgetting that eccentric phase when they're going with the resistance. Okay. Now there's some that do kind of opposite. So I could do concentric only. So here, a concentric only would be pull up, all the way up, all the way up, all the way up, push down. Pull up, 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 push, up, 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 push. So if you want to do concentric only, you can do that. For inversion, okay, I usually stabilize. And then, oh, this foot isn't in the way, but if it has been, sorry guys. Sole of the foot out, and then you're going to bring the sole of the foot inward. Okay, keeping it up in this position. Don't be down low. So start here. Go ahead and pull in all the way in. Slowly back out. In. Slowly back out. In. Slowly back out. And then stabilize. I know you can't see as much. Start in. Out. Slowly back in. Don't let go. Resist it back in. This one's important. Resisting back in. That's the eccentric phase. That's going to help you slow your inversion ankle sprain. It's your peroneal muscle group. I'm working on the lateral aspect. So when he everts here and here to here, that eccentric, that deceleration will help if you get strong there. When you do roll your ankle, those muscles are going to fire and lengthen to stop that ankle from inverting and hurting the lateral ligaments. All right. So I think I covered, yeah, all 4 ways. Manual, let's do some bands. So bands, with this band, put it on the top, start down like a gas pedal. And you want a long band here. You don't want it short. And go ahead and pull up, toes to your nose, all the way up, slowly back down. Good, all the way up, all the way down. So that's resisted dorsiflexion. You get a cramp? Yeah. Now you need a massage. You can lay down too if that's all right if you lay down on your back. On this one, a little Velcro strap I'll put on just to show you. So for plantar flexion, this needs to always go around the ball of the foot. So we don't want it up really high near the ankle. We want the longer lever. So you want to have this resistance down here. For plantar flexion, if you're going to use bands, just give the resistance to your athlete. And then they can generate as much tension as they can tolerate. Okay, and then just rotate this a little bit. And then I'll come out to the side, watch his hip again, make sure that his hip is locked in his ankle. Make sure, sometimes you give him a cue, bring your toe right to my finger. But sometimes they're down really low. So you want to make sure they're kind of neutral is where I like to be. But you can even do a diagonal, down and, this one is do down and out, up and in, up and in, down and out, up and in. So there you go, down and out, up and in. Go to my finger. So relax so I can take you. Relax your foot. So you're gonna start here and just a diagonal. You're gonna go up and down and out, up and in. You can do that manual too. Down and out, push down and out, push down and out, and pull up and in. All the way up, toes to your nose, up, up, there you go, down and out. All the way, keep going, there you go. So it's definitely a harder pattern to learn. Go down and out, and then up and in. Good. Versus just straight inversion, which was here. Just turning it. Okay, so for eversion, start in, bottom of the foot turn in towards the band, and then pull it up. Pinky up. There you go, little toe out to me. So again, you want kind of a long band here. Okay, watch that hip. Don't turn your hip. Twist your ankle. Same thing with this diagonal 2 pattern. You can go down and in, kind of like how you sprain your ankle, and then pull up and out. So you can kind of give them that diagonal line that they're going to pull on, down and in, up and out. A little bit easier of a pattern than the other one, the other D1 we call it. Okay. Good. That is bands, and then body weight. When you progress to weight bearing, you can do calf raises. I call them calf raises. Some people call them heel raises. It doesn't matter. And you're just up and down. What I'd like to see is do that. Be on some type of a lift. Gotta get. I have a block made in the athletic training room, just 2x4s. But look where I'm at now. I'm in dorsiflex, so I'm stretching my gastrocnemius, soleus right now. So it's just going to give me more range of motion. So getting on a lift of some sort will give you more range of motion versus just doing them off the ground. Your heel doesn't drop. So it'd be kind of like doing a biceps curl only from here to here, right? You get that full range of motion by getting those toes up. So you do double leg, and then you want to progress to where really full return to plays. You should be able to do 20 single leg calf raises without any pain in the ankle. You do that for a calf strain too, calf strain eval. Then you do 20 single leg calf raises equally left and right without any discomfort. And then the opposite, I call them toe raises. So toe raises, not a lot of resistance. Here, I got my whole body weight. That's why your calves are much bigger than your tibialis anterior. What do you have, to lift up when you dorsiflex, right? Just your feet. Feet is your resistance there. So that's why those muscles are much smaller. Same thing, you can get more range by standing on a lift. Sometimes I just have people isometrically strengthen those and just walk on the heels. You can strengthen the inverters and everters by kind of walking, right? Everters here because I'm everting my ankles, or inversion here. Look at my tibialis posterior. So those are some body weight exercises. All right, lastly, we have proprioception. So proprioception is balance. And all right, pretty sure you guys can see. I'll bring it a little closer. Well, Bob, try some of this stuff too if you want. You should always have your athlete's shoes off for this because shoes give you stability. So it's always better to have your shoes off when you're doing any type of proprioception. The first thing for balance would be standing on the floor. All those muscles are going to be firing and stabilizing. So you get a little wobbly and you can feel it. You can feel all those different muscles just kind of twitching and just trying to stabilize you. So from here, you can make it more challenging by closing your eyes. And then you definitely find yourself swaying a little bit more and even more muscles twitching, pulling. So, I mean, you can do that as soon as you can bear weight and stand on it. You can stand on a pillow. That's all you got. You can stand on a bed, a mattress. You can stand on a cushion from a couch if you don't have all of this all these cool little toys. So the easiest, I think, is what's called a Wobble Board. Kind of has a, kind of rounded bottom to it and a flat top. And this one, I think it's pretty easy. I don't know if I'm lead you or not. But try to balance. You can even make it to where you want them to. With this one, you can plantar flex and then dorsiflex. So you can kind of get some more strengthening and stretching to try to get some coordinated movement. So that's called a Wobble Board. These, I call them Dyna Discs. But again, Dyna Disc is a brand. These are not even Dyna Discs, but they're just inflatable kind of rubber air-filled balance discs. So these are harder. These get pretty challenging. See, I'm wobbling a lot more than I was on the other one. So, not going to be doing this initially. I mean, I've got a healthy ankle and I'm still wobbly. So imagine someone that rolled their ankle. You're not going to just throw them right onto this. Now I have a round piece of wood in the training room, and that makes it a little easier. It's almost like using this, which is a BOHS, kind of gives you the flat surface to work on. So I find the BOHS pretty easy on this side. It's got inflatable rubber on the other side. I find it harder on this side. Other people are different. Everyone kind of their own interpretation of what's, you know, easier or more difficult. You can do bilateral. You can get functional. I mean, even going back to with the ankle, when you do a squat, what's going on with the ankles? And what muscles are working when you do a squat? Eccentrically, the calf is getting longer. Concentrically, it's contracting. Not a lot of range of motion, but the ankle does move, so your calf's working a squat. So you can do the same thing and add some proprioception to it. Right, by doing some squats on a BOHS, sorry, on a disc. You could do it on a BOHS. You could do this one. Slide off. My socks are too slippery. So you can balance here, you know, bilateral. You can add squats here. And then you can get even more functional and challenge the body even more. Maybe you got a baseball player and you're working on, you know, stabilizing with motion. So you can use the rebounder. You can do a bilateral to start. You can just do it on the ground. You don't even need to use a device like this, but definitely more challenging because now I have that component of movement. Again, my foot slipping on my socks. That movement is really throwing my balance off. But it's more functional. Now I've got movement, my foot really has to stabilize. So that's definitely more on the advanced side, but I think I talked about everything I wanted to. Thanks for watching. Bob wants to say goodbye too.
See you guys.
Let me see.